Hi, welcome. My name is Laurie Groh. I'm the owner of Shoreside Therapies, and today we have Katie Fortune with us, and she is at the Glendale office. And I just want to say thanks for being here today, Katie, and I am looking forward to really for you to share your expertise and share what you offer to your clients. So thanks for being here.
Of course. I am so excited to talk to you today.
Yeah, me too. Okay, so let's get to it. So I want to hear a little bit about like your ideal client, right? So just starting with that of who is somebody that you're like you really focus on seeing, who's going to be somebody that's going to be drawn to you and that you work best with.
Absolutely. So I really love to work with the perinatal population. I love to see clients who are struggling with perinatal anxiety. They may have experienced a miscarriage or be experiencing postpartum depression, or just really need a space to kind of process birth experiences or birth trauma. I love to work with women in general, women who are experiencing identity transitions, physical transitions, things like perimenopause or menopause. The transition into motherhood can be very challenging sometimes. I also really love to work with couples. So, couples who are just experiencing communication challenges, issues with boundaries, trust building stuff, fidelity. And then I really also just love to work with generalized grief, depression, anxiety. I typically work with adults, but I also really love to work with children, teens, the elderly population as well.
Yeah.
All
Oh my gosh, that's incredible. That's incredible. And I feel like just specifically too with like that transition to motherhood for me, like
Mm.
looking back, like that was a complete shock.
Oh, yeah. Yeah.
I just, thought, baby, hey, you're so cute and change the diapers and do all the
Mhm.
stuff, not even really thinking about how I would change as a person. And
Absolutely.
yeah, and that is a wild experience in itself.
Mhm.
Yeah.
Absolutely.
Yeah.
And I
So
don't
that,
I don't feel like it gets talked
yeah.
about enough is the all of those different areas that change your relationship
Mhm.
with work, with partners, with friends, everything kind of shifts a little bit. And I feel that it's a really important time to have some really intentional support.
Yes, yes. And the intentional part, I think, is
Yeah.
key, right? Because,
Mhm.
looking back at that time, it was a long time ago, 14 years. But yes, thinking about that time for sure. If I would have been in that position to be like, what can I do here? It would have been so helpful. So I
Ugh,
love that you're doing that
yeah,
work. Yeah.
absolutely.
Amazing. So speaking of that, speaking of your work, what is your general philosophy on helping, your approach?
Yeah.
Maybe share a little bit about that.
Yes, absolutely. So it absolutely kind of depends on the client, on what they're presenting for. For example, perhaps with couples, it will be a little bit more directive. It may be a little bit more focused on skill building. I might jump in a little bit more in session just to make sure that we're using the tools, the techniques that we're really wanting to use to shift those communication patterns. Sometimes it could be a little bit of process orientation as well, if there was fidelity or anything like that that occurred in the relationship. And then for my individual clients, it might be a little bit more process oriented at first, especially if they're presenting with any trauma in their backgrounds or anything like that. So we may spend a little bit more time there and then shift into skill building or coping strategies, stuff like that. So it really depends. I really do want to meet my clients where they're at and have it be really holistic and customized to them. But I kind of take on that mixture of a directive versus
Ah,
process orientation.
yeah, yeah. And I think that is an important distinction too with operating as a couples therapist versus an
Hmm.
individual, because just in general, that just looks so different and you have to do that so very differently. So I like that
Oh,
clarity
yeah.
and that distinction of this will be a different experience. Has to naturally be a bit more directive, right? Because
Hmm.
that's what they're coming for. It's a very different experience, whereas individual work, that might not always be the case. That might not always be the most helpful space to be for
Hmm.
someone. Yeah, I love that.
Absolutely. Yeah.
All right. So, what can a client expect to experience with that session? What could somebody expect? Because when they're coming in, a lot of times there is that anxiety about that first
Mhm.
initial session. And so it could be helpful to hear a little bit about what someone could expect.
Absolutely. I feel it is really helpful for clients to know, have a little bit of an idea of what they're going to be experiencing in therapy. So, and again, it kind of depends on what clients are presenting for, but a lot of the time I will structure sessions a little bit, especially with my couples, that if we need some time to, again, kind of go into that processing space of a conflict or a communication experience, we may do that for a little bit and then really go into here are the goals that we're focusing on. What are some of these tools? How are these tools working for you? Did we have a chance to practice them? And then really going into how do we want to be experiencing growth within session and carry that out into our relationships with each other, with family, with friends. And it's a little bit similar with my individual clients as well, where I structure it a little bit. But I also really want to follow clients' leads. I really want it to feel collaborative in the space as well. So if I am introducing a tool that is not resonating, I really want clients to feel that they can tell me that. And I do also really provide a lot of resources and tools. So they'll often go home with resources, communication, boundary setting, because again, I really want it to feel like we're getting a lot of beautiful work done in session, but that they're able to really carry that out into real life experiences.
Right. I really like that focus of here in the moment, but also the reality is it's typically right, like that 1 hour a week,
Mm-hmm.
and then you have the whole rest of your time. And that can be the hardest part is things can feel
Mm-hmm.
really, really great in the room. And then, but what do I do when I actually try to use some of those tools? And
Mm-hmm.
the integration piece is so
Yeah.
extremely important. And so I love that somebody can know, hey, this is going to be a part of this process with Katie, is we're going to
Mm-hmm.
get good work done here and then get good work done
Mm-hmm.
here as well, right? And then there's always going to be those challenges outside of the session, and then being able to
Mm-hmm.
tweak and say, okay, what worked, what didn't, how did this exercise feel? Really,
Yes.
yeah, really great.
Yeah. Absolutely. I wanted to feel like they're really getting to invest a lot into their strength, their growth, their goals. And I feel that that can be
Mhm.
a really helpful way to approach that.
Yeah. And I'm curious on those same lines. So, as that work's going on there, I'm just imagining that movement would happen quicker with like that focus
Mm-hmm.
on integration. When you're thinking about like the results for a client, what they expect to feel, maybe what they expect to do within that work with you. Obviously, it's not like just this check mark and like, come here and this is what's going to happen. But people want to know, hey, what can I actually expect is going to happen through the process of therapy? Lots of
Yes,
different
yeah.
answers, but yeah.
Mhm. Yeah, what I've really seen and what I love to really see is I think clients can really expect when they're really, intentionally doing this beautiful work that their relationship with themselves will also start to shift where we're noticing a lot more self-compassion. There's a
Yeah.
reduction in the more negative self-talk or self-criticism, that their kind of self-judgment is starting to shift as well. And those feelings of shame are really
Yeah.
reducing. So that's something that I really like to look for. And of course, we want to keep an eye on our symptoms reducing. Are we
Yeah.
noticing anxiety coming down? And I'm always hopeful that through,
Mhm.
using things like the GAD-7, the PHQ-9, those kind of formalized assessments, we can keep an eye on those types of things. I love to see when it's just such a special moment where clients' relationships with themselves start to feel safer, more compassionate, that they
Yeah.
feel at home in their bodies again. And that's my hope, is that that is something that they can really expect working with me.
Yeah, Katie, I'm actually getting emotional hearing that because it's so beautiful. And that experience as a therapist, there's nothing like it, right? When somebody is able to just say, oh my gosh, I didn't say that to myself this time.
Yes,
it's,
it's so
it's just
powerful.
it's so wonderful. It's so
Yes.
wonderful. Yeah. Or even like when they say, I heard your words, this week, or
Yes.
I've had some clients bring it to me and be a little bit like, is this normal to like hear you? I'm like, yes, yes, but that's actually
Yes.
your voice.
Yes.
You're taking in what we're doing. That's what that means. And
Hmm.
it's so incredible because some things aren't going to be as clear as taking those assessments. Sometimes
Yes,
it's just going to
absolutely.
be like, my body feels different. I feel less tired. I feel more open.
Hmm.
I can hear myself talk differently. So I love that. I love that.
Yes. Oh, thank you.
Yeah. Yeah. Um, so I'd love to
Okay.
hear your strengths as a therapist.
Absolutely.
Just talking to you and knowing you this far, even the tone of how you speak is really calm. And so I'd say just right off the bat, that's a strength.
Thank you.
Just like that, I feel like sometimes that energy makes all of the difference when you're in the room, right? We're virtual
Hmm.
now. We're not feeling that as much as when we're in the room. But I want to hear a
Hmm.
little bit about what people have said, what you've noticed as your strengths.
Course. Yeah, absolutely. I think one of my biggest strengths is my consistency. It's very important to me to be on time, to be available, to be scheduling consistently, responding appropriately and on time, and then also be consistent in how I respond to my clients. That they know that there's trust there, so that they can trust that I'm consistently compassionate, non-judgmental, in this really safe space. Because, like you said, it is such an important part of the work is that rapport, that safety in the room. I also I love to learn, outside of session. I'm always doing research, taking trainings. I really want to be able to support my clients in holistic, customized ways, and that involves being up to date in trainings and things like that. I also really try to bring humor into the space where it feels appropriate, that we're human. I want to connect with you as a human and have that really warm connection with you. And ultimately, I really do. I want this to be a compassionate space where we can feel free to experiment with things, where it's safe to be wrong sometimes
Right.
and to practice being wrong and taking
Mhm.
accountability. There aren't a lot of those really safe spaces out just in the wild. So I really
Right.
want to create that in the room. So those are just a few of my strengths that I
Yeah.
really try to be prioritizing each and every
Yeah.
session.
Yeah. Knowing you this far, I would say that that's very accurate. One of the things that drew me to you was us nerding out on let's learn more.
Yes.
How much can we take in? And
Right.
I think that's one of the key components of Shoreside in general is like that
Hmm.
is a huge thing because there's always going to be new information. And with that, with science, with studying and with our knowledge and
Hmm.
experience, things are going to change.
Hmm.
Even as a therapist, right? Like how we were as a therapist 5 years ago is going to be different than we are
Hmm.
now, right? Which is a weird feeling,
It is.
but also really, really great to like go through different trainings and learn more and keep
Hmm.
growing as a therapist. So really appreciate that about you. And I think that's a great
Yeah.
asset for anyone that comes to see you.
Yeah, absolutely. I feel
Amazing.
it's such an important piece of it.
Yeah. And so, Katie, just want to double check anything we didn't go over that you want to talk about, bring up that you would want somebody to know, any messages maybe you'd want your clients to hear.
I would just really want to emphasize that I know that starting therapy can feel intimidating sometimes. Some of my clients have had kind of negative experiences with previous therapists as well, and that can make it difficult to
Yeah.
really come in openly and trust the process. And I just want to really emphasize that that's very normal. And that I think at Shoreside, we just emphasize so deeply that we want to be specialized and continue to grow and learn, like you said, so that we can really be a safe and trustworthy space for clients.
Yeah.
And that just feels really important to me to know.
Yeah. 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 I love that. Thanks so much, Katie. It's been
Thank
wonderful
you.
talking with you. Yeah.
Thank you so much.
Yeah, we will talk soon. And for anyone that wants to reach out to Katie, you can go to our website at shoresidetherapies.com. And all of our information is there. And you can fill out a form. You can reach out to her directly. So totally up to you. And thanks again, Katie. We'll talk soon.
Thank you.